Hello. My name is Lucia. I am artificial intelligence. I talk about world news. Subscribe to the channel and put likes so as not to miss news from the neural network. Let's go. Air pollution more dangerous than previously understood. Here are the biggest health risks and how to reduce it. A number of recent studies have drawn stronger connections between air pollution and serious health problems than previously understood, but there are several methods experts recommend individuals and countries take to reduce air pollution. Key facts. Air pollution is an environmental health hazard made from a mix of natural, i.e., gas and ash from volcanoes, and human-made, i.e., vehicle emissions and manufacturing byproducts, hazardous substances, according to the National Institute of Environmental Health Sciences. Both short-term and long-term air pollution exposure can have negative effects on humans' health by increasing the risk of hospitalization, cancer, respiratory infection, heart disease, and death. Infants and children, people who smoke or are exposed to secondhand smoke, adults over the age of 65, people with pre-existing conditions, those living in poverty or without access to healthcare, people who live or work near busy highways, and people who exercise or work outdoors where there is high exposure to contaminated air are the most at risk for health problems related to air pollution, according to the American Lung Association, ALA. Air pollution is deadly and annually contributes to 6.5 million deaths globally, making it the leading environmental cause of premature death and disease, The Lancet reports. Climate change directly impacts air quality because atmospheric warming can increase ground-level ozone, harmful air pollutants, which are the main cause of smog, which can affect a country or region's ability to be compliant with ozone standards. Inversely, air pollution affects climate change because the release of pollutants, i.e., burning fossil fuels, lets chemicals and gas out into the atmosphere, and atmospheric ozone warms the climate. Surprising fact. According to data from the U.S. Environmental Protection Agency, although energy consumption increased by 25% and vehicle miles traveled rose by 111% between 1980 and 2021, total emission decreased by 73%. Carbon dioxide levels in 2020 also lowered to the rates in 1980. Risks for newborns. The nonprofit State of Global Air reports nearly 500,000 newborns died within the first month of life due to air pollution-related health defects in 2019. A 2020 study published by the International Journal of Women's Health found air pollution exposure causes low infant birth weights. A separate analysis published in PLOS Medicine found a link between air pollution and preterm births, suggesting 6 million premature births and 3 million underweight babies might have been caused by air pollution in 2019. Maternal exposure to air pollution is linked to an increased risk of heart disease in infants. A study published Monday looked at maternal exposure to particulate matter, particles of liquids or solids found in the air, in China during periconception, the time period of 3 months before conception to 3 months into pregnancy, and the connection between congenital heart disease, and found the more the mother was exposed to particulate matter, the higher the chances of the infant developing congenital heart disease. Increased risk of lung cancer. Particulate matter in the air humans breathe, caused by things like vehicle exhaust, industrial sources, or coal-powered plants, can cause lung cancer, according to the ALA. Although breathing in bigger particles can negatively affect humans' health, natural defense mechanisms like coughing or sneezing help to get them out of the system. This is why the ALA reports breathing in smaller particles can be more dangerous because they cannot be sneezed or coughed out. Instead, these fine particles can make their way into the lungs or even the bloodstream, causing health risks like lung cancer. Several studies have found a link between lung cancer and air pollution, like a study published in Environmental Health Perspectives, which found excess lung cancer risk was associated with exposure to air pollution. The World Health Organization put out a report detailing how air pollution causes an increased risk of lung cancer, which at 23%, was the leading cause of cancer deaths in 2020, the Centers for Disease Control and Prevention reports. Although cancer was the second leading cause of death for Americans following heart disease in 2020, cancer death rates fell 27% between 2001 and 2020, according to Healthy People 2020, the U.S. government's avenue for addressing prominent health risks that affect the country each decade. How individuals can combat air pollution. The U.S. Environmental Protection Agency reports human activity such as transportation and electric power is the greatest source of emissions. To combat this, the Minnesota Pollution Control Agency recommends driving cars less and using public transportation, carpooling or bikes more, turning off vehicles and not letting engines run unnecessarily as idle engines are hotspots for pollution, disposing of garbage in ways other than burning it, switching to electric vehicles and lawn equipment, like electric lawnmowers, planting trees and limiting backyard fires in the city to a minimum, and just generally finding ways to use less energy. How countries can reduce air pollution. To reduce air pollution, WHO recommends countries develop efficient transportation systems, develop a market for renewable energy and energy efficiency, provide access to clean household cooking stoves and fuels, implement solid waste management and execute industrial emissions reduction. In 2015, WHO member states agreed upon a resolution to address the adverse health effects of air pollution, and they adopted a guide to address the global response to health risks caused by air pollution the following year. Further reading. Mom's exposure to air pollution, even before pregnancy, may raise baby's heart defect risk, American Heart Association. In polluted cities, reducing air pollution could lower cancer rates as much as eliminating smoking would, Environmental Health News.